Skin lesions. A skin lesion is a part of the skin that has an abnormal growth or appearance compared to the skin around it. Two categories of skin lesions exist, primary and secondary. Primary skin lesions are abnormal skin conditions present at birth or acquired over a person's lifetime. Secondary skin lesions are the result of irritated or manipulated primary skin lesions. For example, if someone scratches a mole until it bleeds, the resulting lesion, a crust, is now a secondary skin lesion. A benign lesion is non-cancerous whereas a malignant lesion is cancerous. For example, a biopsy of a skin lesion may prove it to be benign or malignant, or evolving into a malignant lesion, pre-malignant lesion. Excision benign lesion procedure method. The area to be excised is marked with a surgical marker. After administering a local anesthetic, the physician makes a full-thickness incision through the dermis with a scalpel, usually in an elliptical shape around and under the lesion. The lesion and a margin of normal tissue are removed. The wound is repaired using a single layer of sutures, chemical or electrocauterization. Complex or layered closure is reported separately, if required. Each lesion removed is reported separately. Excision hidradenitis procedure method. The physician performs a wide excision of the affected skin and subcutaneous tissue of the marked region including margins. Intraoperative mapping of any existing sinus tracts may be performed to ensure complete removal. The wound is left open to heal by granulation or is repaired using single or multiple layers of sutures, or if more than layered closure, complex repair, is required. Excision, malignant lesion procedure method. After administering a local anesthetic, the physician makes a full-thickness incision through the dermis, usually in an elliptical shape around and under the lesion. The lesion and a margin of normal tissue are removed. The wound is repaired using a single layer of sutures, chemical or electrocauterization. Complex, layered, or reconstructive, excluding adjacent tissue transfer, wound repair is reported separately, if required. Each lesion removed is reported separately. For excision of malignant lesion, immediate reconstruction with local flaps may be necessary and is also reported separately. When frozen section pathology shows the margins of excision were not adequate, an additional excision may be necessary for complete tumor removal. Use only one code to report the additional excision and re-excision, S, based on the final widest excised diameter required for complete tumor removal at the same operative session. Excision or destruction, e.g., laser, intranasal lesion, internal approach. External approach, lateral rhinotomy. The physician removes or destroys intranasal soft tissue lesions using techniques such as cryosurgery, chemical application, or laser surgery. The physician performs a lateral rhinotomy by retracting the lateral ala to expose the internal nose. Cryosurgery will freeze and kill soft tissue lesions. Laser surgery will vaporize and emulsify the lesions. Chemical application of topical vasoconstrictive agents and local anesthesia cauterizes vessels and limits post-surgical hemorrhage. No post-operative wound closure or intranasal packing is necessary. Excision of lesion of tongue without closure. Excision of lesion of tongue with closure, anterior 2/3, posterior 1/3. The physician removes a lesion in any area of the tongue. Incisions are made in an elliptical shape completely around and under the lesion. The lesion is excised. Due to the small size of the lesion, no suturing or closure of the surgical wound is necessary. Excision of lesion of tongue with closure, with local tongue flap. A flap of mucosa from another part of the tongue is incised, moved, and sutured to repair the surgical wound. The donor site is closed with sutures. Excision, lesion of palate, uvula, without closure. With simple primary closure. With local flap closure. The physician removes a lesion of the palate or uvula. Incisions are made completely around and under a lesion, typically in an elliptical shape, removing the lesion. Excision, lesion of palate, uvula, without closure. With simple primary closure. With local flap closure. The physician removes a lesion of the palate or uvula. Incisions are made completely around and under a lesion, typically in an elliptical shape, removing the lesion. Excision of lesion, conjunctiva, up to 1 cm. Over 1 cm. The patient's face and eyelid are draped and prepped for surgery. Local anesthesia is administered. A lesion on the bulbar or palpebral conjunctival is excised with a curette. Sutures may be required to repair the wound. Excision of lesion, conjunctiva, with adjacent sclera. The patient's face and eyelid are draped and prepped for surgery. Local anesthesia is administered and a lid speculum is inserted. A lesion on the conjunctiva and adjacent superficial sclera is excised with a curette. No sutures usually are required. Radical excision external auditory canal lesion, without neck dissection. Through a post-auricular incision, the physician uses a scalpel to remove an extensive lesion in the ear canal. Depending upon whether the lesion involves bone, a section of supporting hard tissue may be excised. The tympanic membrane, parotid gland, facial nerve, and portions of the mandible and mastoid may also be removed. Radical excision external auditory canal lesion, with neck dissection. The physician performs a neck dissection, removing the lymph nodes from that side of the neck. The jugular vein, spinal accessory nerve, or sternocleidomastoid muscle may be removed as well. The carotid artery, vagus, sympathetic, phrenic, brachial plexus, hypoglossal and lingual nerves are spared. Excision soft tissue lesion, external auditory canal. Through the external opening of the ear, the physician uses a knife to excise a soft tissue lesion with surrounding margin or normal tissue. Some limited drilling of the ear canal may be done. The external ear canal may be packed. If extensive skin is removed, a separate grafting procedure may be required at this time.